Connect Fountain project will work to increase community connectedness, connect youth and families to existing programs and resources that they might not be aware of, collaboratively create more safe spaces and opportunities for young people, and work with existing programs to enhance their ability to serve youth and families and meet those needs. By implementing this project as a coalition and collaborating with new and existing community partners in Fountain, we believe we can increase safe spaces for youth, a sense of community connectedness, and opportunities for youth and families. And on the last slide, you'll see that the Fountain Valley CTC Coalition has had numerous accomplishments to date, including efforts that work to build community capacity, strengthen that community collaboration, increase youth engagement and empowerment, and prevent youth substance use. In our first year of DFC funding, we collected over 270 pounds of unused and expired prescription medications in an effort to safely dispose of them. We also distributed 240 prescription medication lock boxes to families in the Fountain Valley to encourage safe storage of medications. Both initiatives were an effort to prevent opioid addiction from ever beginning in the home, and also to prevent unintentional poisonings. Other notable accomplishments are listed on the slide. We at CTC are proud of our accomplishments thus far, and we look forward to building on our success through the Connect Fountain project. Thank you.
Okay, and I think that I keep seeing Susan pop up there. I don't know if we'll be able to hear her. If she, Director Whelan, do you have anything you want to add to that?
I don't. Can you hear me?
We can this time, yeah.
Oh, okay. I don't have anything to add to the great our team is doing related to addressing the youth substance abuse. I think that you know what Becca had stated was an implementation only funding opportunity, which I think speaks to the work and the relationships that we have in the south part of the area of the county. So I think that's noteworthy. And so my audio is a little bit.
Yeah, you're kind of fading in and out.
When I do my director's report, then I will pick back up if it's okay to say a few words about Dr. Tirbush's leadership service as the president of the board, if that works with Mr. Colas.
Yeah, that'd be fine. Okay, so we have a resolution to approve funding that is coming from the Colorado Trust Culmination Grant. And Zico?
I don't believe we have, what is resolution? I apologize. Absolutely. Resolution number 2023 blank. Resolution to recognize revenue and appropriate expenditures in the amount of $222,219 for the Colorado Trust Culmination Grant that will support the Connect Fountain project as contracted with the Colorado Trust. Whereas funding for the Connect Fountain project will work in conjunction with the El Paso County Public Health Fountain Valley Community That Cares program. The Fountain Valley Community That Cares program was recognized for their efforts in the Fountain Valley region for working with youth substance abuse and prevention and invited to apply for this grant. And whereas the FVCTC was formed in 2017 to address youth substance use, violence, and mental health. The coalition consists of community members, youth, and partner organization representatives actively engaged in planning and implementing strategies to enhance economic stability and promote healthy social and community contexts in the Fountain Valley region. The FVCTC will oversee the Connect Fountain project. And whereas the Connect Fountain project emerged from youth and family input, requesting more opportunities and programs that would increase community connectedness in the Fountain Valley region. In combination with existing action items created by the coalition, strategies were identified to meet this need for connecting the community to existing resources, as well as identify and implementing needed opportunities for positive youth development. And whereas the expected outcome for the project is to increase participation in existing programs, opportunities, and resources, increase community capacity to meet identified needs for youth and families, increase capacity of program and services providers to enhance youth and family engagement, and increase access to safe spaces and community connectedness. And whereas funding for the Colorado Trust Culmination Grant in the amount of $222,219 will be effective starting on January 1st, 2023, and will end December 31st, 2023. Now, therefore, be it resolved that the El Paso County Board of Health does hereby recognize revenue and appropriate expenditures in the amount of $222,219 to the El Paso County Public Health 2023 budget in the following manner. The revenue will be $222,219 from the Colorado Trust Grant, and the appropriated expenditures will be $47,644 in personnel expenses and $174,575 in program expenses. Done this 25th day of January 2023 at Colorado Springs, Colorado.
Thank you very much. We need a motion.
I'll move to approve, and then I'd just like to add a comment there as well. I've got to work with them for many, many years now. The program down is in the south side. They've done previous great work in helping youth fighting tobacco use and youth down there. And I do know, I was there at the drug take back as well, which saw, I think, a threefold increase, if not more, in terms of what was being dropped off. So doing great work down there, and so I fully support this.
Great. Do we have a second? Thank you, Doris. And any other comments from the board?
Can I have, Becca, can I have a question for you? I'm sorry, I may not have understood, but can you explain what the safe spaces are, please?
Yes, that's a great question. Safe Spaces through CTC is identified as a place where young people feel they can truly be themselves and they don't feel a pressure to use substances. So the way that it's kind of addressed through CTC is actually through a strategy that's called Build Public Support for Creating Community Spaces for Youth. And the research that they have done through kind of surveying youth have said in like private places, such as friends' homes, sometimes school or parks, are where maybe we think sometimes that it's considered a safe space, but that's actually where they get kind of approached a lot in terms of substance use and that pressure. So they've addressed other places such as like Boys and Girls Clubs or the YMCA, where there are adults present, there's activities, they're more academically kind of pushed to really value academics. Kind of after-school programs like that tend to be considered among youth a safe space, and they feel they don't experience that pressure from maybe other youth to use substances. Does that answer your question?
Yes, thank you.
Yeah.
Any other board comments? Yes.
I'm not a board member, but it does appear that there are two action items, Mr. President. The first is to approve the contract itself, and then the second is to recognize the revenue and appropriate the expenditures from the contract. I apologize, I don't know which motion or which item Commissioner Gonzalez's motion was to approve.
Okay, why don't we do them in order? State the first one again.
The first one is to actually approve the contract with the Colorado Trust Culmination Grant.
Okay.
So moved.
Okay.
Second.
All right, all in favor?
Aye.
Aye. Online there? You see two thumbs up from? Gotcha, thank you, sir.
Do both?
All right. And the second is?
Thank you. The second item is the resolution that I just read, which is to recognize revenue and appropriate expenditures.
Okay. We have a motion to accept.
Move to approve.
Second.
Second, all in favor, say aye.
Aye.
Online? Got two thumbs up there. Thank you very much. Thank you, Becca. And it is a great program. I'm glad I got the chance to go down and visit with you guys now.
Yes, thank you.
A question for her.
Oh, I'm sorry, Becca, we do have a question for you. Go ahead.
Becca, has there been any conversation about expanding this to other communities within the county, like Manitou Springs? I know funding is always a consideration, but since looks like it's very successful, didn't know if there had been conversation about that.
Yeah, I don't know if there's ever been any, I don't want to say, I don't know how to phrase it, of like really professional conversations about it, but I have had a lot of people approach me in other communities asking about this funding and asking how to procure that funding, kind of other communities in El Paso County, so that we can they can build off of the success that we've had in the Fountain Valley. And truthfully, like being so involved in this program for 2.5 years now, I think it should be everywhere. This is upstream prevention, and you get numerous sectors involved in upstream prevention efforts. To me, you are more than likely going to be successful in your efforts. And if that means that we're creating a safe space and a safe community for young people, I want this to be everywhere personally, and I hope that other communities can procure this funding. Yeah.
Thank you.
Yeah. Any other questions? I'm sorry I ran. Okay, thank
I
you.
think you're free now.
Thank you.
Okay, looking at our agenda, that takes us to new business. Yes, please.
I just wanted to mention that Becca is scheduled to present to the Opioid Council, our Region 6 team, and there are going to be opportunities to learn the work that they are all doing, because it is a gold standard, very effective prevention model that Becca talked about, numerous different efforts and then different funding sources. But our hope is that more people will learn about prevention, and that's where we'll get more support in the communities when we're focusing on prevention. And treatment is very important as well. And there's different collaborations and relationships with that. But I did want to highlight that she will be presenting, and Becca, I think, is probably going to run to that meeting today, but she is sharing the great work that they're all doing around prevention. So our hope is that it expands.
Thank you. Thank you for letting us know that. Takes us to new business, and we have a resolution to adjust compensation for our public health director. Okay.
Resolution of the El Paso County Board of Health. Whereas pursuant to Section 25-1-508-5C1 CRS, the El Paso County Board of Health, or Board of Health, has the power and duty to employ a public health director for El Paso County Public Health, or Public Health, to serve at the pleasure of the Board of Health as the administrative and executive head of public health. And whereas Susan Whelan currently serves as the public health director for public health, and whereas the Board of Health evaluated Ms. Whelan's performance during her annual review held on December 14th, 2022, finding her work and leadership to be exceptional and having no concerns. And whereas the Board of Health noted in particular Ms. Whelan's emphasis on collaboration with community partners, her innovative approaches to addressing public health issues, and her efforts in building, empowering, and supporting a skilled and dedicated public health workforce. And whereas the Board of Health also reviewed the salaries of other members of county leadership and of other public health directors in Colorado, and whereas, in consideration of the above, the Board of Health wishes to increase the annual salary of Susan Whelan, Public Health Director, by 2% as a pay for performance increase in recognition of her exemplary performance, and an additional 5% cost of living increase in conformance with the across-the-board increase approved for all county employees, both effective January 8th, 2023, and resulting in an annual salary increase to $206,858.08. And whereas the Board of Health also wishes to grant Ms. Whelan a one-time performance award of $5,000 for her performance in 2022. Now, therefore, be it resolved by the El Paso County Board of Health, number one, that compensation for the Public Health Director shall be increased annually per the provisions set forth above. Number two, that any future salary adjustment for the Public Health Director position may be made by the Board of Health either by resolution or by direction given to staff at the sole discretion of the Board of Health. Any cost of living increase or other across-the-board increase in benefits provided to full-time public health employees as a whole will apply likewise to the Public Health Director. Moved, seconded, and adopted by the El Paso County Board of Health at its meeting held January 25th, 2023.
Okay, do I have a motion to accept this resolution as read?
I move to approve the resolution of the El Paso County Board of Health, our compensation and public health director, Ms. Susan Whelan.
And we need a second?
Second?
All right, all in favor?
Mr. President?
Yes.
Sorry, before you call the roll, it would be appropriate to ask if there are any comments on the resolution?
Oh, okay.
Or discussion?
Are there any comments on the resolution? The online attendees?
Well, I'll just say, I was not at the meeting last year, or last month, because of other commitments, but this is in line with the counties, as was mentioned, across the board raises, so it seems appropriate.
Okay. Any other comments? Okay, not hearing any. All in favor, signify by saying aye.
Aye.
Got a thumbs up from General. And any opposed? Okay. Well, that resolution passes. And that brings us up to Director Whelan's director report. And hopefully our audio is good and we can have you take it from here, Susan.
That was good, so let me know if it goes out. And I'll try to stay focused with some of the background and choppiness that I'm hearing. I wanted to pick up where the comments led off with Dr. Chervish's service for his leadership on our Board of Health as Board of Health President. I have tremendously appreciated his leadership, his mentorship, his steadfastness with supporting all staff and being an advocate for our public health staff during some of the most trying and most times.
Again, Susan, it looks like we've lost you. Technology is wonderful when it's working right. And when it isn't, we kind of sit here in limbo. We want to be respectful of everyone's time, and as they're working on that, I know that Susan wants to say a lot about her friend and mentor, Dr. Terbush, and hopefully we'll have the opportunity to do that. But right now, I know in her director's report, the first item that is up is a briefing by Dr. Albanese with regard to respiratory illness update. So Dr. Albanese.
Okay, is this working? Great. Good morning, board members. Nice to be with you today. So let's start by taking a big breath in and a big breath out, because that's about what this update represents. So it's nice to be coming to you with some sort of a little reflective information now, because it feels like we are a bit past the hump of what we've been concerned about all winter in terms of these diseases. So next slide, please. So we'll move from COVID and RSV and flu. So the key COVID updates, we had a modest sort of winter COVID season thus far. But for the most part, the indicators that we're monitoring, cases, the percent of tests that are positive, hospitalizations, are for the most part decreasing. It's been a wobbly season if you just sort of look at the trends, but we appear to be hopefully steady on the decline. There's been a lot of regional variability that we'll talk about in a second in terms of what's been going on with cases and hence the variance. And so the CDC continues to monitor the variant data. The Omicron variants are continuing to be the show for the past 12-plus months. We have a new alphabet soup. We're up to X, believe it or not. So this XBB 1.5 has now become the dominant variant, so all the Bs have sort of faded away, and now we are in the X's, and so we're going through those letters. And there's a lot of regional variation around the country. Why do we care about XBB? Here we go. Well, in the laboratory, when we test this version of the virus against the blood of people who have had previous infection or had this vaccine or that vaccine, and you mix them together and you shake it up, what happens? What we want to happen is that the antibody bonds to the virus and gives us evidence that would kill it, right, as part of the immune process. And this one, just like what happened with the other earlier Omicrons, show that it doesn't bind as well as before. And there's also concern that the manner in which this virus infects cells in our bodies, that it could be more catchy. These are exactly the characteristics that we've seen in other variants. It tends to sometimes escalate. It tends to sometimes be similar. This variant has escalated a little bit, making us worried about things. But the bottom line is we can do this in the laboratory, and then there's us. There's real people, and we have to see how this virus behaves. So it's relatively the newer one. We've only had it around for a few weeks or so in our region. We don't have the data yet to see if the outcomes, right, the health outcomes of people infected with this variant will end up being different, even though in the laboratory there are things that we're paying attention to. That's the bottom line. Next slide, please. So this is a pie of the percentage of variants circling around the regions that are in the country in the background. So you can see the Northeast, as it's been with the other Omicron variants, kind of starting in the Northeast, and then it will march our way eventually. So what are we observing in the Northeast? Well, they were wondering whether there might be more hospitalizations. They were wondering whether there might be more severe disease. It's just simply too early to tell. Are we going to have more XBB 1.5 in Colorado? Yes, we are. Do we know whether that's going to cause us a particular problem? We don't. So next slide, please. So where we are right now with our 7-day average of COVID cases since September of last year, you can see that the average rate is still continuing to decline. We'll see if there's some intersection once XBB 1.5 gets here in greater proportion, but right now the trends are looking favorable, so we'll see what happens. Next slide, please. This is our El Paso County hospitalization data, and you can see on that graph in the center of the slide, which is since the end of December. Again, you sort of see this wobbliness, but generally decline in hospitalizations. And again, hopefully this persists. We're hoping people still try to get their Omicron bivalent booster. We know that people are still getting infections, and we have some natural immunity. So we still know that this is impacting older persons. So none of those characteristics really have changed in quite some time. So collective fingers crossed that we get through the rest of this winter season without too many problems. Next slide, please. Really, I think the big story of the winter all along has also been about RSV. We've been talking about this for a couple of meetings now. Through last week, we've had over 2,300 hospitalizations. This has been a big impact on children. We've had many, many outbreaks in pediatric settings. This is a pediatric disease and really relative minimal problems in long-term care facilities, which is the opposite of influenza. Next slide, please. So I wanted to just reflect on what the RSV experience has been likely in Colorado. So this is data from the Denver metro area where we track RSV hospitalizations of all ages. On the bottom are the calendar weeks. It begins in and around September and October. On the left side of the graph moves on through into the middle of the year. So we're in the winter months. That current season, it pretty well stands out, right? These are hospitalization rates. Pop, wow, wow. Early season, big, big, big disease. lots of impact on kids. I highlighted a couple of the previous seasons in the different colors, where you see the curve of the graph seems to come a little bit later in terms of the peak. That would be a normal RSV season, and not nearly as much disease. That would be a normal RSV season. This was not a normal RSV season. It was a pop wow, very early, very severe, but we are pretty confidently past the peak of that, and hopefully we'll just ride out the rest of the winter without a lot of problems. Next slide, please. This is the pediatric curves, right? So again, the pediatric hospital admissions are driving the trends in these graphs. You can see again this early peak coming in October and November for RSV. And compared to the past 3 seasons, which are the other colors on the graph, you can see later peaks, much less severity. So we just had a bad RSV season, and hopefully it's in the rearview mirror at this point, and we're getting through it. Next slide, please. And just to do a little bit of comparison between last winter season and this winter season with flu, RSV, and COVID. RSV is in green, flu is in blue, COVID is in orange. These are pediatric hospitalizations. You can just see we had some experience with these viruses last year, except flu, which is in blue last year. On the left side of the slide was kind of non-existent compared to the other two, right? But we had some RSV, we had some COVID, okay? And this year, RSV just stealing the show. We still had more flu disease this year in the pediatric age group than last year. Less COVID disease in the pediatric age group, like just this flip-flopping. But again, the story this year was RSV in kids, and particularly in toddlers, and particularly in infants for RSV disease. So again, thankfully, we're moving past that, and all the pediatricians and everywhere in the state are just also breathing a sigh of relief. Next slide, please. So let's move on to flu season. Again, this is flu hospitalizations, also what we carefully track in El Paso County and in Colorado. And like RSV, a little bit of a wonky season, right? We talked about, so in pink, that line is the current season. The calendar is on the x-axis. We're talking about increase in October and November. This peak looked like it occurred around mid-December, which is probably 4 to 6 weeks early than normal, right? So we had an early flu season. We had a moderate flu season, right? Some other years are on this graph in the blue and the green and the orange, where it fluctuates a little bit. No doubt that it was early. Probably a pretty good punch for flu in terms of the severity of the season this year, based on our hospitalization rates and our percent positivity that I'll show you. So, but again, we see a very consistent decline. Sometimes we see a little bit of a blip because mostly this has been influenza A, which is one type of strain. There's also influenza B. Influenza B in Colorado typically comes as a little hump, sometimes in February and March. Since we're only in January and everything came early, we're probably going to see a little flu B now, but it doesn't go crazy like flu A. So we'll see a little bump, and then hopefully by March, April, we'll be starting to come out of the season. Next slide, please. So this is our percent positivity. In percent positivity in blue is flu A. In the orange on the bottom, that's really hard to tell, is flu B. But again, if you look at the peaks there, based on percent positivity, kind of ignore that dip. That's probably might be a reporting artifact. But basically, again, peaking around mid or so December. So for all of us who are betting on when we might have peak flu season, go ahead and start paying out now, because I think we pretty well know what happened. So next slide, please. So this is statewide flu hospitalizations, and just showing again, comparing this season across the state compared to previous. So to the left of the slide, labeled current flu season, is what we're going through now. That other big peak in blue, that was 27-18. So that was a bad flu season several years ago. It peaked right around the beginning of January, a little more severe in terms of hospitalization rates than we had before. But otherwise, I think other than the earliness of this flu season, we sort of call it a moderate season, and again, hopefully coming out of it. And I think that might be my last slide. Oh, one more. Okay, one more comparison to compare flu hospitalizations with COVID hospitalizations. So the reason I wanted to show you this slide, again, these are hospitalization rates. We have the dates on the bottom. So you can see where COVID was for the past 2 winter seasons and sort of the wow of COVID hospitalization rates, like really high. And if you sort of look at those time periods and just move your eyes down the slide, the bluish colors are the flu seasons. And again, just COVID just took over, right? Just relatively speaking, this is with whatever prevention measures that we were trying to do, even with the changes of social distancing and quarantine and isolation and trying to use vaccine and trying to use masking, this disease still hit us really, really, really hard. This is what a pandemic does. Hopefully we are looking at all of this in the rearview mirror. And it really, it's only now in red is our current COVID disease rates. I'm going to point to that real quick. Right here, right? And that red trend just tells us, you know, for this season, it's sort of like mapped head-to-head with flu almost, right? Like, so for finally, after 3 years of this pandemic, we had a COVID winter season. That may be what our norm looks like in seasons to come. This virus is not going to go away. We'll likely have it next year. We'll see what our public health approaches will look like in terms of vaccine and so forth come next winter. But we sort of had a head-to-head flu and COVID season. Okay, we're paired up, added to the list of things that will circulate in the winter moving forward. So that's probably what we're looking for next year. But again, thankfully, sigh of relief. Hopefully we're getting out of this season and we can look forward to the spring and freshness and blooming. Thank you. I think this is at my last slide, and I'm happy to take questions. Thank you.
Okay, any questions from board members?
Question. I have a, what's with the price of eggs? And you can kind of see where I'm pulling the thread on this. What types of influenza are we?
Well, so for human diseases,
Yes.
we have influenza type A, and there's different strains based on two other letters, our alphabet soup, H and N. And then there's a type B, which also has a couple of different strains that circulate every season. So we learn from what we think is going to circulate in the northern hemisphere, hence the United States, from what happens in the southern hemisphere during our summer. And so that data is what the World Health Organization uses and the CDC and the FDA uses to try to construct our influenza vaccines. And so last February, they were observing what was happening on the other side of the world, and they put our vaccines together. And so for the most part, what they predicted in the vaccine is what's ended up being circulating. So there were no surprises for the human disease that we're experiencing now. By the way, the FDA is trying to set up the same type of program for COVID so that we narrow things down to one type of COVID vaccine. That's it. Not a whole bunch of different flavors, one type. They're going to try to, the proposal is that they try to do their prediction in June of each year, have the vaccine manufacturers create their formulation. So by September, we have the vaccine that we think will cover what will likely circulate. We get vaccinated, we get through the winter. So they're trying to normalize it on a similar schedule that we do for influenza. So that's a little aside. So I think what Dr. Turbush is referring to is bird flu, right? So flu infects many mammals and birds, not just us, right? We have pig flu, we have bird flu, we have human flu. So there is an avian influenza that has been circulating pretty heavily around the country. That's called H5, right? So the human is called H3, H1. The avian influenza is labeled H5, so it's still within the influenza family, but a different structure of the virus. And so this virus has been plowing through bird flocks all over the country. We have it here in Colorado. We have it here in El Paso County. And so for the most part, it sort of likes to stick with birds. It was not good for birds, not good when they infect poultry. And then you have, poultry hang out, like birds hang out together. We hang out together with humans. It's worse in birds, right? Like they can transmit to each other very, very quickly. You can have bird die-offs very, very quickly. And so that's what's been happening. And when it happens in the agricultural industry, we end up having a spillover, I guess, Dr. Turbush, into the economics of poultry and eggs and so forth. And so I'm not going to try to explain what's going on with egg prices, but that's what I'm reading as well.
I think you just did.
Thanks.
Yeah, so, but again, I'm not an economist. So anyhow, so we do have concerns, though, because what we don't want to do is have those viruses enter into the human population, and then we have yet another new strain that people haven't seen before. Oh my goodness, I'm not going to say the pandemic word again, right? Like, so this can sometimes be the origins of influenza viruses causing pandemics. If you have something that used to be in a different type of animal or bird species and then gets passed over into humans, and we're like, we've never seen this thing before. And so we run into an issue. And so we pay attention to bird flu, and we pay attention to bird flu in Colorado. And sometimes if we've had humans who have been interacting with these infected flocks or birds, they get monitored, they get tested, just to make sure that we're not showing evidence that it's in fact being introduced into the human population. So far around the country, it has not. There's been a lot of bird death, and there's been, as of yesterday, the day before, one human case that's been documented. So let's just keep that separation. They do those things, we do our things, and we just keep it separate.
Thank
I hope
you.
that answers your question.
Thank you, Dr. Albany.
I do have one question for you. Early on in the season, when the RSV and everything was at its peak, it was reported that there was a shortage of antibiotics to treat these diseases. Now that the peak has fallen, are we seeing those supplies come back? Are you aware of any of that?
Yeah, so I think there were a couple of things. So this is impacting the pediatric population, and so it ended up having kind of a relative shortage of over-the-counter medication to help treat symptoms, and even things like Tylenol, right? So, and so I don't know if that was just a mix-up with supply and demand or some production issues, but it's rebalanced. The antibiotic issue was sort of a little bit weird because we don't use antibiotics to treat these viral infections, right? Antibiotics don't work for viral infections, but you can get sometimes when you have a viral infection, it make you more prone to ear infections or sinus infections, for which you want to use some antibiotics. And so even the basic antibiotic like amoxicillin, there was a relative shortage, but I think that's also starting to correct. So it was just sort of kind of things that aligned at the wrong time.
Thank you.
You're welcome.
Other question? Anybody online? I don't think we could hear him anyway, but thank you, Dr. Albanese.
And President Colas, if we could try one more modality to have Susan be able to participate in this meeting with us.
Sure.
I have her on speakerphone, so we'll see if we can hear Susan this way. Director Whelan?
Okay, let's try this as a backup. Can you hear me now?
We can.
Board of Health and folks, if I can get a thumbs up.
We can hear you, thank you.
Okay, wonderful. Thank you so much, Dan. Appreciate it. So picking back up, related to my comments around Dr. Turbish's leadership on the Board of Health, and then we have another presentation for my director's report. I wanted to mention, in addition to all of your expertise, Dr. Turbish, I think what really shines through for our team is your compassion and your kindness. And I did want to acknowledge many of our staff have signed on to a kudos board, and we'll share this at expansive in another time, but at the town hall. But I did want to read many of the comments and that of appreciation and thank you. And one of the comments is, thank you, Dr. Turbish, for your support of and encouragement to our staff at El Paso County Public Health. I always felt you wanted the best for the citizens of El Paso County, as well as the public health staff. And that's from one of our nurses, Carrie learned in our immunization program. Another one is thank you for your dedication and your promoting and supporting the health and wellness of our community, from Brittany Rifle. She is our youth and health wellness representative. And there's so many more in here that we will share, but I did want you to know that you are highly regarded, respected, and I appreciate your honorable service, especially in these last few years, as I've been with the agency for over 20, and it has been the most trying and challenging, and we've come through it as a team. And I think that overall, I think that everyone has done a really good job. So thank you for that. And so more to come at a all staff town hall, Dr. Turbish, that we will be having in early February, and our new president of our board, Ted Colas, will be in joining us during that meeting. So look forward to that. A couple of other comments before we jump into the last presentation is I did want to thank all of the board members that were present at the UCCS commencement speech that I provided mid-year. That meant a lot to me, that you all were able to take the time and join me in that event. And I know some of you had let me know, due to your busy schedules, that you weren't able to make that, but that meant a lot to me. So thank you so much. That was really a wonderful experience, and it was so nice to have you all join that event with me. So thank you so much for that. The last presentation that we have is, I believe, an extremely relevant topic with what we're seeing around the nation and experiencing in our own communities. The need for emergency preparedness and response, and a strong effort from our agency that focuses on our public health responsibilities. And so we have Janelle McNair, our Emergency Preparedness and Response Program Manager, who is going to provide some information on our specific area of responsibility. And I am incredibly pleased to share that our agency, due to the hard work of our emergency preparedness response and their leadership, as well as our entire staff, with the value that we place on emergency preparedness and response, that we have received and achieved national recognition through Project Public Health Ready for 2020 through 2027. And our agency has to meet rigorous standards for this achievement. And if you all remember, we had Lisa Powell with us, who has served numerous years with emergency preparedness, and her leadership has been invaluable to the success that our agency is involved in. And so wanted to recognize our El Paso County team and our entire staff, as when there is a emergency, we shift our duties and we prioritize what we're responding to. And that certainly happened in the COVID pandemic, where many of our programs had to cease their normal operations to serve in various different emergency preparedness and response roles. And so I think that this is a testament to all of our staff and all of the teamwork and work that we do with the Pikes Peak Office of Emergency Management and our numerous partners. So with this, Janelle, if you want to, you're already up there, I think, or maybe it's Deanne. I can't see.
She's on her way up.
Okay, wonderful. But, there's a variety of public health responses and where our lanes of responsibility are, and so I wanted to provide more information on what that looks like, because it's so important that that you all know that the role that we serve in, and that with every different aspect of emergencies that we are responding to. So, Janelle?
Thank you so much, Susan. It's good to see everybody again this morning, too. Hi, I'm Janelle McNair, the Emergency Preparedness and Response Program Manager here at El Paso County Public Health. And I have had the opportunity to stand up here in the past and tell you about our program. But today, I really wanted to provide you a brief overview of how public health fits into the overall emergency management structure for El Paso County. Next slide. So we have what I've referred to as the National Response Framework before, and it is the guide on how the nation responds to emergencies and disasters. It is built on a scalable and flexible adaptable framework, which we have also adopted at the state and local level, the National Incident Management System. So within this system, there's also what we call emergency support functions. These are organized into groups, and they provide personnel, resources, facilities, equipment used in our response. So within El Paso County, we have what is called 15 emergency support functions. El Paso County Public Health falls within Emergency Support Function 8, which I'll refer to now as ESF, which is the public health and medical. Within that group, or that emergency support function, we have several partners that we work with regularly through response, through planning, training, exercise, evaluation, and that includes our local hospitals, our emergency medical services, our coroner, our Medical Reserve Corps, our behavioral health partners, and partners from our South Central Healthcare Coalition. Also, obviously, working very closely with our Office of Emergency Management. Next slide. So here you can see an overview of the 15 emergency support functions that the Office of Emergency Management coordinates, and this is how we are organized in a county for emergency response. So we're right in the middle there, public health and medical services. And each of these groups has, as I mentioned in the previous slide, specific capabilities, authorities, capabilities, personnel, resources that would be appropriate for activation during an emergency response. So emergency responses are scalable. They can be something very small where it's one organization responding, and they can be very large, such as the Waldo Canyon fire or the COVID-19 pandemic, where there are numerous agencies responding. So the agency that would take the lead on something would be where their appropriate capabilities and authorities would lie. So, for example, if there's a wildfire in the county, public health is not going to lead that event. That's going to be our fire service. Public health may be called to support the event, but we would not necessarily be the lead. Likewise, if it's a disease outbreak or an event like a pandemic, you wouldn't want fire leading that event. You'd want public health leading it. Sorry, all right, I better change course. So something, for example, like a lost hiker, you've got search and rescue. A hazardous spill on I-25, we have our hazmat team. If there's a sheltering need or mass care, we have our ESF 6, which is Red Cross. So there are identified organizations and agencies that lead each of these emergency support functions. Next slide. So how a lead versus support agency is determined is based on the incident, and it can come about different ways. So it could be, a fire starts and 911 and CSFD responds, and if the incident continues to grow and they need additional resources and support to the incident, they could then ask for assistance from our Office of Emergency Management and request resources, capabilities, support, personnel through the Emergency Coordination Center. So the incident commander at that scene is requesting activation of the Emergency Coordination Center to assist with resources. The Emergency Management Coordination Center will determine which agency should be activated based on the slide I just showed you previously to support that type of an event. Additionally, so the support agencies are activated through Office of Emergency Management. We do not self-deploy in any event, just to maintain that appropriate organizational structure for emergency management. And I wanted to point out as well that while, wildfire is a great example to use for incident command in the field, our incident command for public health actually is within this building. So we would set up incident command in our department operations center, and we would establish our incident command structure. So the location can differ depending on the event. So for public health, it's often a very sustained long-term response. And for other events, it may be something that can start and end, within an hour or, a few days. But public health is something that we've seen through the pandemic that can last quite a long time in that incident command structure. Next slide. So public health is the lead agency for disease outbreak, for communicable disease. It's where our authority, our personnel, our expertise lies. And it is the expectation that public health would lead a public health response to that type of an event. So we would take the lead and have many times some examples up here for the hepatitis A response, which was right before the COVID-19 outbreak, and most recently the monkeypox response. Like I mentioned, we establish an incident command structure just as any other agency would for an event, and we manage our response by objectives. So we develop our incident action plans, we set up an appropriate structure which is scalable and flexible. It may involve the entire agency, as the COVID-19 pandemic did, or it may be a smaller scale where only certain sections are activated, like immunizations and communicable disease and public information. In all of these responses, we participated with, obviously, the epidemiological investigation, pharmaceutical interventions, non-pharmaceutical interventions, public information and education. All of these things are part of this response, and working with lots of different partners. So hepatitis A worked very closely with the homeless outreach team. For the COVID-19 pandemic, worked very closely with everybody. That was definitely a whole community approach there, and monkeypox with partners for targeted communication and outreach as well. Next slide. So a lot of things happen in the county, and they're not always a disease event. So we are a support agency to many things that occur. There's a health and medical component associated with almost all emergencies. And so when we are requested to support an event through the Office of Emergency Management, we will activate as the Emergency Support Function 8, and we will work with all the partners that I mentioned previously, our health and medical partners. We've talked a lot about Club Q. That was a very, the most recent event that we supported through coordination of behavioral health resources, and we are still heavily involved in those conversations. Additionally, something like the Waldo Canyon Fire, our agency was involved with creating reentry guidance for residents that were returning to their homes for cleanup and food spoilage, manning the Emergency Support Function 8 desk at the Emergency Coordination Center. Environmental Health did well inspections. So there are so many different departments within our agency that have a role to play in these responses as a support entity. After a fire comes a flood. So with that, our agency participated in the Disaster Assistance Center, provided immunizations, tetanus vaccines and shots. And so lots of different areas in how we support as an agency. In December alone, we were heavily involved with coordination of the behavioral health resources for Club Q, maintaining that situational awareness of the pediatric RSV, and in constant communication with our children's hospital. We did prepare a medical surge tent in the event that it needed to be quickly deployed. Luckily, they didn't need to utilize that resource. Also maintaining situational awareness of the migrant situation that was occurring right around the holidays with the pending expiration of Title 42, which did get extended, but we had a responsibility to lean forward and plan for that. So we reached out to Denver Health in being prepared for if a bus shows up in the middle of the night on Christmas Eve, we had a plan to get us moving in the right direction. So, and then additionally, the Ebola travel monitoring was continuing throughout that month as well. The World Health Organization did just call an end to that on January 11th, but working with communicable disease who would receive information from CDPHE, Colorado Department of Public Health and Environment, and we would then filter that information to our hospitals so that they have situational awareness on how many travelers were being monitored within the county. So pretty busy month of December. Next slide. So moving into 2023, as Susan mentioned, we're extremely proud to have earned the re-recognition through Project Public Health Ready. We are currently one of 2 health departments in the state that holds that recognition. We are working to facilitate our quarterly trainings with our El Paso County Public Health staff as we're kind of moving into this renewal and, being able to recover, and we're in that preparedness cycle where we're going back into updating our plans, and we're doing our training and exercises. We have several community-wide exercises that we'll be participating in, such as the medical surge exercise in May and the full-scale airport exercise in September at Colorado Springs Airport. We're also proud to be presenting our Emergency Preparedness and Response Onboarding Guide at the National Preparedness Summit in April through the National Association of County City Health Officials. So a lot to look forward in 2023. We never know what emergency is going to happen when, so having this this dedication and committed El Paso County Public Health staff for being ready to respond whenever we need to has been a top priority for the agency, and I think we're proud again of the recognition that demonstrates that. Our agency is very committed to training and exercising staff. And again, not sure what 2023 will bring, but we'll definitely be ready to respond if we're called upon as a lead agency or requested to support from Office of Emergency Management. Any questions?
I don't have a question, but I just want to say thank you for the work that you're doing. In my previous line of work, we called it keeping the axe sharp, right? You don't know when you're going to use it, but it needs to be ready when you do use it.
Yeah.
And the preparedness, the training, the exercising, the things that you do to prepare so that when the community really does need you, you're ready to jump into action. And that goes for everybody that fills every one of those 15 ESF functions. It's important work. And again, you don't know when you're going to use it, but when you're called upon, being able to have relationships already formed, to know people, to know contacts and resources that you can contact at a moment's notice in the middle of the night to get the support that you need, that doesn't happen by accident. That happens through a lot of dedicated staff time. So I appreciate the work that you do to keep our community safe.
Thank you. Thank you.
I see a hand up in the audience. Councilor Strand, come on up.
I'd like to ask Ms., and I'm come up to the mic. Hi, Ms. McNair.
Hi.
I had a question, Mr. President. I'm Tom Strand, and I'm on the Board of Directors for Utilities, as is Mr. Donaldson. Monday, we had this terrible situation at the Regency Towers on 8th Street. There was a transformer that went out there. It's a senior living center, 55 and older, but a lot of the residents are much older than 55. And I'm wondering whether your group gets involved in something like that, where we've got 200 to 300 people in the middle of the night, 20 degrees outside, and how we help them. And I was wondering if you could answer that.
Thank you for that question. So yes, we were involved. We were called by Office of Emergency Management, and the request at first came for assistance with obtaining bottles of oxygen. So we did work with our team and our logistics coordinator to get 30 bottles of oxygen ready. However, we did then get a call back 30 minutes later stating that that was not needed at the moment. So we put a hold on that. However, what we were notified is that they were evacuating the building in its entirety, and there were several individuals that were COVID positive. So they had requested public health assistance in finding a location for those individuals to stay the evening. So worked with our El Paso County Public Health leadership team and our team members to discuss some options that we could pursue. And we were able to reach out to City Hope, who worked with us to get 5 rooms ready. However, when we let Office of Emergency Management know that the rooms were available, the individuals had found alternate locations. So this all did happen pretty quickly. It took us approximately 2 hours to get the location set up and ready, but by that point they had found alternate sheltering. So we definitely do get called to assist in these types of things, and this isn't the first time we were involved with that building. There was a fire there a few years back as well, and we assisted with the Red Cross shelter that was set up there and provided some wheelchairs for some of the individuals and assistance with medication retrieval. So I hope this is the last time that we're involved in that building. But again, understanding that there was a request for assistance from our Office of Emergency Management to support, and our team was ready to do whatever they could. So thank you.
Thank you. And thank you, Councilor Brand, for bringing that up, because my brothers and sisters from ESF 4, the firefighters, worked pretty hard that night, carrying people down 11 stories multiple times. Really proud of the effort that they put in there to keep people safe.
Yeah, the elevators won't work with any power. Without power.
Without power, yeah.
Thank you. And related to our emergency response efforts, certainly having a scalable and flexible response is important for our community, and knowing when to deploy resources and when to scale those back is part of what EPR helps us achieve. And we have joining us virtually, so I understand will be able to hear her, is our COVID response manager. And she is just going to provide us with a brief overview of our scalable community-based testing site approach and what remains in terms of availability to support testing in El Paso County. Alicia, are you able to present those slides? Do we have audio for Alicia? Okay, it appears that we're still having some challenges with the audio, so if I could ask for you to advance the slides, and I will try my best to fill in for Alicia.
Can you call her on the phone like you did with Susan?
Do you have her number handy? Okay.
Hello?
Hi, Alicia, it's Vicki. Go ahead
You're live.
You're in a
and
room with 40
present.
people. Yeah.
Okay, can you hear me now?
We can, yes.
All right. Okay, well, good morning. I'm Alicia Humlachek, the COVID-19 response manager for El Paso County Public Health. And I am going to present a few updates regarding COVID-19 testing in El Paso County. So in partnership with the Colorado Department of Public Health, El Paso County provided free COVID-19 tests at community-based testing sites from August 11th of 2020 through January 15th of 2023. Over the course of the pandemic, additional testing sites were added at different geographic locations across the county in an effort to reduce barriers and offer free and convenient access to COVID-19 testing to El Paso County residents. The total number of COVID-19 tests performed at the community-based testing sites was 429,521. Next slide. Additionally, our El Paso County Public Health Lab ran 9,616 tests during the 2021 to 2022 timeframe, utilizing a targeted testing capacity for outbreak settings. The EPCPH lab remains available for COVID-19 testing should the need arise. We also ramped up distribution of home test kits in preparation for the closure of community-based test sites. All three El Paso County Public Health sites have test kits available for ongoing distribution, and we continue to increase distribution events in the community. In total, 29,839 home test kits were distributed in 2022. And that concludes the testing updates. Thank you.
Okay, thank you.
Thank you, Vicki. Thank you, Alicia. And I do still have Director Whelan with us. Director Whelan, any final comments?
Those conclude my comments, unless there's any questions in addition to those already stated.
Any questions from board members?
Any questions?
Director Whelan, thank you. It doesn't appear that we have any questions. We appreciate the updates.
Thank you. Have a wonderful day.
You as well. Okay, I'm getting a message from Commissioner Bremer. Oh, okay. Nothing to report, but thank you, everybody. And at this time, we've completed our agenda. I will entertain a motion to adjourn. Or we can stay.
So moved.
Second.
Second, all in favor?
Aye.
Aye. Thank you, everyone. We're dismissed.